How come there's more policemen than people?
Because there's more policemen. Is everything?
Yeah, I got food.
Hi, everybody.
Hi, Jack!
Hey,
Hi, Jack!
Hi, Ray.
Gordon, good to see you again.
Nice to see you. Thanks for all your help on the internet. Hey, I'm glad there were a small crowd so I don't have to have everything repeated. I have to express my gratitude for your invitation and for your being here.
Hi, Jack!
I think it's very important the Occupy movement has changed the nature of the dialogue in America, and it sure needed changing. And it's only because people took to the streets that anything was going to happen, because the media was avoiding all this for oh so long that things have gone tragically wrong. I'm a family doctor in Ocean Beach, and I am here out of gratitude for your energy. I think that the healthcare system is a subsidiary of Wall Street. I represent an organization called Physicians for National Health Program. We are over 18,000 physicians and other health personnel across the United States. One of our staff actually started the Occupy in Washington, D.C., which was previously scheduled before the Occupy movement. Today, Sunday, people from PNHP in New York are giving free flu shots to all the Occupy people in New York City. Our organization supports single-payer health insurance, which is essentially improved Medicare for all, and is predicated on the fact that we have to get rid of insurance companies, which are an agency of Wall Street. And that's why we're brothers under the skin with the Occupy movement. I've got 2 points to make today. One is the menial ripping off of sick people by the insurance companies, and the other is how bad the healthcare system is in the United States. I see this every day in my office. I have about 10% of my practice on welfare, Medicaid, Medi-Cal. I have another 10 or 15% uninsured people. Most of those people used to be insured and used to have jobs. So I see it on a day-to-day basis. Just to give you a couple of examples, last week I saw a fellow who worked as a mechanic who told me he couldn't go to work anymore because the pain in his back was too bad. He's fully insured. And I asked him why he didn't get his surgery. He says, I haven't been able to come up with $100 copay for my MRI, which the surgeon requires. And as soon as I get it, I'll get my x-ray and then I can get on the way to surgery. Meanwhile, he had to stop working. I have a friend of mine who had a heart attack when he was 52 years old. He does communications equipment installing, like telephones and internet, things like that. Because he's a small businessman, he had an affordable health care policy. After he had his heart attack, his pharmacy benefits ran out for the year approximately May 7th. That meant the rest of the year he had to pay out of pocket approximately $200 a month for his medications. Since then, he's gone through bankruptcy. His house is in foreclosure. He has a heart pacemaker, and I was able to wrangle a pacemaker check for free from some cardiologists, but he kept coming into my office holding his chest and complaining of chest pain. I did a cardiogram for him for free, and it showed he was in the process of having a heart attack. I gave him the cardiogram. I said, you get on to Mercy Hospital and ask for this doctor, and they can't turn you away. He says, well, what about the bill? I said, you got to live. You can't avoid it anymore. You have to go. So he did go, and he had his stent had blocked up. He needed another heart procedure, and he's alive today due to the goodwill of the healthcare system, not because the system is working well. I really want to start by quoting a statement made by a doctor who I admire very much. He's English, or actually more truthfully Welsh, and this is called the inverse care law. It's written by Julian Tudor Hart, a family doc in Wales. Quote, The availability of good medical care tends to vary inversely with the need of the population served. This inverse care law operates more completely where medical care is exposed to market forces, and less so where such exposure is reduced. The market distribution of medical care is a primitive and historically outdated social form, and any return to it in England would further exaggerate the maldistribution of medical resources. I don't think that's been said any better. That was said 40 years ago in 1971. England has a national health system and we have yet to achieve that. But the problem has been demonstrated in the United States over these past 40 years. Market medicine does not work for the good of the people. And I think that's what the Occupy movement's all about. I can quote for you infant mortality figures. Infant mortality in the United States runs about 6.8 deaths per 1,000 live births. In Japan, after 10 years of recession, it runs 3.8 deaths per 1,000 live births, about half of what it is in the United States. I can quote for you infant mortality by states. Those states which have the most conservative Tea Party Republicans have the highest infant mortality. States like Louisiana, Mississippi, Tennessee, and Texas. I can quote for you the fact that we have many counties in the United States, and if you can see this map, they're in red. Guess what these are? These are counties in the United States where the mortality of adult women is increasing. No small number of places. Grown women are dying faster in these counties now than they did 5 years ago because of the great healthcare system that we don't have. Now, maternal mortality is another thing. Maternal mortality means women who die in the process of giving birth. It's so bad in the United States that Amnesty International wrote a whole report on it. A whole report. The average maternal mortality in the United States is 9.5 per 100,000 live births. In California, it's 17, almost twice as much. African Americans in the United States have a maternal mortality of 33 per 100,000 live births. Speaks to the inequity across the races that we have in this country. So, I can give you statistics after statistics. Here from the Journal of the American Cancer Society, the 5-year survival rate for all people with health insurance is, and all cancers, is 80%. That is all cancers, men and women, all across the United States. 80% of them survive 5 years. However, if you happen to be on Medicaid or have no health insurance, your survival for 5 years for the whole population is 65%. It goes on and on. We have, by some estimates, 40 to 80,000 excess deaths in the United States due to medical conditions which could be treated if we had an adequate health care system. Of course, other countries have good health care systems. Just to quote you some statistics, in the United States we have, I'm going to do admission rates per 100,000 people in 2007. In the United States we had 441, while places like Norway, Denmark, Canada have less than 150. We have asthma admission rates per 100,000 people aged 15 and older. In the United States it's 120. In Switzerland, Netherlands, Sweden, Germany, it's less than 30. We have people who don't get preventive medicine, so they end up in the hospital. This is not only pain and suffering, this is tragedy. And as a matter of fact, we were all around in 2009 when President Obama put forward his plan to change healthcare in America. What did he do? He subsidized Wall Street by putting the plan out that you would all get better if we only had health insurance. As I told about my patients with health insurance at the beginning, The anecdotes show that health insurance is not the same as medical care, and it's getting worse and worse all the time. The cost for premiums, the cost for co-insurance, the cost for deductibles, the co-pays on medications, generally, on the average, in the United States for insured people, amount to 20% of family income. 20% of the average family income in the United States. If the cost of eggs had increased the same amount as the cost of health care in the United States since 1945, a dozen eggs would cost $55. If the cost of a gallon of milk had increased the same amount as the cost of health care, it would cost $48. That's how much health care has escalated and what we pay for it, even though it's inadequate. In the United States, we pay an average of $7,500 per person per year. That's twice as much as the next country in the world with an organized healthcare system, and twice as much as England does, for instance, with its organized healthcare system. And where does this money go? A large amount of it goes to insurance companies. Again, as a practicing physician and as a social politician, I have to say that in my opinion, what's happening with insurance companies, it's the same thing that happened with banks. They're subsidized by the government, and they're ripping off people who are sick for their own profit. Before I get to that, I'd like to quote another statistic which was done by doctors in our organization, Physicians for a National Health Program, and it was done in conjunction with a professor from Harvard Law School whose name was unknown at the time. So it's co-authored by Elizabeth Warren, and it points out that in this country 65% of all the personal bankruptcies are due to illness or medical expenses. So the tragedy of illness is compounded by the economic tragedy that these families undergo. And half of those people had health insurance at the time they got sick. Either their health insurance didn't cover the cost of their illness, or they lost their insurance because they lost their job due to being sick. So the statistics are overwhelming and overwhelmingly tragic. Now, to get down to the Occupy and we being the 99%, I want to share with you some facts about the financing of the healthcare system. Administrative costs take off the top 30% of all the money that's paid on healthcare premiums. The fact is that insurance companies have what they call the medical loss ratio. That means how much money they have to spend on medical care rather than retaining to hire their own staff and pay their own exorbitant salaries. So the actual figures for 2008 and 2009, which I have here for the 7 largest insurance companies in America, they only pay anywhere from 82 to 86% of the money they take in for health care. The rest of the money goes to themselves for intense bureaucracies and excessive salaries. Now again, the only way you can actually relate to this is to know the actual figures. So I'm going to quote the figures for 2009, when this country was debating health care and what we need to do to fix it. What happened was President Obama cut a deal with Wall Street, and he decided the way to fix it was to subsidize insurance companies by forcing everybody to buy insurance. Okay? And that was an extraordinary rescue of the commercial health insurance companies, which were in a death spiral. Let me tell you what a death spiral looks like. In 2009, the 5 biggest insurance companies, names you will recognize: WellPoint, United Health Secure Horizons, Humana, Cigna, and Aetna. They combined had a total net profit, after all expenses were paid, a net profit of $12.1 billion. That was 56% more than in 2008. Where you learn what was going on with the business model of insurance companies is to look at their number of enrollees. They made a $12.1 billion profit while they served 2 million less people. 2 million less. They still had 100,000 enrollees, but they had 2 million less enrollees. So they were charging more, they were covering fewer people, and they were making bigger profits. Well, if you follow that out, pretty soon there's only one person named Warren Buffett who can afford insurance in the United States. Until President Obama stepped in, and he mandated a federal law to bail out the insurance companies. That's actually what the Congress approved, in our opinion, in 2009. To be more specific, let me tell you some salaries in insurance companies. The executive officer, the chief executive officer of Cigna earned $15.2 million in 2010. The executive officer of WellPoint earned $13.5 million, one person. Steve Hemsley, the head of United Healthcare, only earned $10.8 million. 1 year, in 2007, he earned 1/17 of all the money spent on healthcare in the United States. His salary's actually gone down, and it's still over $10 million. So the insurance companies impose an incredible, expensive, inefficient, wasteful bureaucracy. Now there's another thing about insurance companies, is they're criminals. They're effing crooks, okay? In January 2009, the United Healthcare Group agreed to pay $350 million to settle class action lawsuits filed by physician and healthcare members over the fact that they underpaid providers in their network. In 2009, United Healthcare also paid $925 million in a class action settlement because its CEO backdated his options. That's almost $1 billion. So they're out to make money, there's no doubt about it. The other big part of the ripoff in healthcare comes from the drug industry, the pharmaceuticals. As you may know, in 2006, George Bush created Medicare Part D. Medicare Part D was like shuffling around, you know, the three nuts with the ball under one of them. So they had this big hullabaloo because they were going to pay for medicines for senior citizens under Medicare, but it forbid the federal government for negotiating with pharmaceutical firms for the price of medicines. And it also said that all the medicines that were previously paid for by the state for their welfare patients were now going to be taken over by the government, the federal government, at the higher prices. So I have here a report from the U.S. House of Representatives dated July 2008, which actually lists the manufacturers 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. And they got a windfall because of this legislation of $3.739 billion. That's money that the states saved by negotiating with pharmaceutical firms that was now no longer able to be saved because of the new federal law. You may not be a political junkie like I, but the congressman who negotiated that law was a guy named Billy Tarzan, and as soon as the law was passed, he quit being the representative from Louisiana, and he went to work as executive director of the American Pharmaceutical Association. So can you see why I say that as a practicing physician, I love the Occupy people, because you're putting all this on the table, how our country is run for the benefit of the corporations and how it's ripping everybody off with a devil-may-care attitude. They're ripping the foundation out of our democracy. To go on with pharmaceutical firms, let me point out that this is not dated, but it's 2010. GlaxoSmithKline had to pay the government a $3 billion fine for irresponsibly advertising its medication. I don't have the date here, but Pfizer paid a $2.3 billion fine. It was that big because it was the 4th time they were caught violating the same thing, and they had consent orders with the U.S. attorney that they would never do it again. They were inappropriately advertising their medications. So pretty much I'm going to stop there, except to point out one more major fact. That when you look around epidemiologically across the world, and this is in a beautiful book called The Spirit Level, published by 2 medical epidemiologists in England. The Spirit Level assessed using United Nations figures a whole bunch of parameters of social morbidity, not just infant mortality and life expectancy, but such things as alcoholism, the number of people in prison, the number of teenage births, mental illness, drug addiction. And they showed that across all the countries in the world that this was not related to how wealthy a country was in terms of its per capita income, but it was clearly related to the maldistribution of income, to income inequality. So when you have what Occupy is protesting about, a situation where income is greatly maldistributed in a society, you not only have more sickness, you have a whole range of social problems that are not going to be solved because the people that are running the country don't give a damn. So that's the end of my talk. It's only a few minutes, but I'll be glad to discuss things and take questions. If you want to raise a question, I'll repeat it. Yes. The question, the lady wanted to know, part of the health reform legislation was if there were going to be health care exchanges in California, which is a very sophisticated question. A health exchange was mandated by the new law so that people without health insurance could go to a place and have state-certified bona fide benefit plans so they knew what they were getting, and they could enroll in ordinary insurance with premiums that were clearly specified, including co-payments and deductibles. Now it so happens that, in my opinion, California led the nation because it passed the first legislation to implement the establishment of health insurance exchanges. Currently there are 6, maybe 8 states in the whole country that have implemented the health reform legislation. This is supposed to go into effect in 2014. Now I would say 2 other things about health insurance exchanges. One is, 3 things. One is that they will make an individual policy much more accessible. 4 things. But it will not have a public option. Remember, public option was ruled off the table by the insurance companies. It had a half-life of approximately 6 hours in the halls of Congress. Just a second. Secondly, the health insurance exchange mechanism does have a very radical potential, and that potential is likely to be realized in the state of Vermont first, because the state of Vermont has actually passed single payer for all legislation that needs to be implemented. And my understanding is that it will come to pass through the health insurance exchange mechanism once they are able to get a waiver from the federal government. So there's a great deal of potential there. The third thing is that health insurance exchanges are very fragile creatures because they're subject to exploitation in terms of what's called adverse selection. They would suck in and attract the most sick people first, and therefore they would be very, very expensive. So in California, the law and the committee that's implementing the law has said that insurance companies, unless they make themselves available through the exchange, would not be able to sell commercial insurance to other people unless they participated in the exchange. So somebody up there is thinking of us. Another question.
Okay, so they've been trying to get on the board natural care, natural science care, physical natural science care, alternative medicines such as, you know, homeopathy, different types of natural herbs that insurances would be able to cover for these are alternative medicines. If we see a lot of the medicines that the industry of medical has approved, it has already been disproved that some of them are unhealthy for a long period.
Ask a question.
Usage.
Ask a question.
So the question is, will the government apply towards the states of 50 unions from the federal compensation for the people of some type of a match program? So a doctor or a health practice can give them the optional choices and still have health coverage and still have the federal government helping us with these financial
Okay, I think I understand your question. The question is, will alternative and complementary therapies be included in the future healthcare system? So the answer to that is two parts. One is currently the Institute of Medicine, which was mandated by the new law to define the basic benefits, in my opinion, did not even include the basic medical benefits in the required minimum benefit plan. And so the federal regulations are very skimpy in terms of straight line medicine. The second thing is that single payer, which I support, would allow any licensed practitioner to participate. And in this state, I'm proud to say I'm personally responsible for establishing the legal regulation of acupuncture. And this state has licensed naturopaths and licensed chiropractors. So if single payer, which is what my organization supports, were to come to pass, there would be enough money saved by not feeding the greedy insurance companies to allow alternative medicines to be part of the healthcare system.
Ron here.
Yeah, the Seroquel that my wife is on, she bursts through it and she goes back into a manic state. Right now she's at Mesa Vista Hospital. She's been treated for this since 1971. And is there any medication that, I mean, she was on Zypraxin. There doesn't seem to be a medication that successfully keeps her from going into the manic state.
The gentleman asked a question about his wife, who was on a very strong medicine to help balance her brain, and I'm not sure I'm qualified to answer that. These medicines are covered through the government programs, but they don't seem to be working for his wife, and I don't think that's a personal problem, not a system problem.
And the second question is, we're $112 over the limit line for her to stay on Medi-Cal, and because we went over $112, she's getting disqualified on the Medi-Cal.
Well, I happen to know the medicine of which you speak, and the medicine probably costs between $250 and $300 a month. And what the gentleman said, his family income is $112 a month over the line, so he can't qualify for Medi-Cal, so the medicine will no longer be subsidized. And I say there's a good example of tragedy and exploitation in American medicine. It's absurd, it's tragic, it promotes suffering, and it ought to be stopped as soon as possible.
Right here.
What's this?
This is the petition for SB 10.
So I'm going to circulate a petition to support Senate Bill 810, which is single payer for California. If you want to sign it, please do. Question over here.
Is it true that the Obama administration favored a single pay program but simply had to do something else because they couldn't get it through the legislature?
No, I think the president is beholden to Wall Street. Goldman Sachs was his biggest contributor during his presidential campaign. And you know what he did with the banks. The insurance companies are just general partners of the banks. So I think when Mr. Obama was a senator, I've seen the videos, he supported single payer. But as soon as he had to make money, he became beholden to the financial establishment, and we're all getting screwed.
Weren't his hands, this is a financial question now that you've mentioned Goldman Sachs, but weren't his hands tied by what the Republicans did after the election and before his administration took power?
I don't believe so.
I do.
Question?
You got a question?
Lady in the t-shirt.
No,
He's
the guy.
busy. You have a question?
sir?
Yes.
Derek, did you have a question?
Mine was answered about California Senate Bill 810.
810.
Got a question?
Yes, I have a question about what is called what physicians sometimes call defensive medicine, and the fact that physicians have to order tests just to make sure that they don't get sued because a patient came in for a totally different problem.
What's your question?
I'm sorry?
What's the question?
If you let me finish, I'll ask it of you. I'm trying to explain what my understanding of defensive medicine is. My question to you is who benefits besides the trial lawyers who were mostly support the Democrats because of the defensive medicine?
Let me try. Let me try and explain the question. The question is that there's something called defensive medicine, which is what doctors have to do to cover all the spaces so that they're not subject to criticism and malpractice allegations if something goes wrong. And I would say that that is a very important issue, much more important issue than the politicians give it credit for. The issue of defensive medicine or overuse of the medical care system. And I would give some specific answers. One is that in my office, where I've known some patients for 20 or 30 years, I can avoid ordering some very expensive tests because I know the patient pretty well. But if I was a doctor in the emergency room and the patient came in with a headache, for instance, I couldn't get away with not ordering a CAT scan or an MRI or a lumbar puncture because there was no way. I didn't know this person before, and I won't see him again, and I've got to cover all the bases. So it's not really in the doctor's head that he's wasting money, it's that he's only got one shot to get it right, and he doesn't want to see any harm. So this makes things very expensive. But it also reflects the fact that in the United States, we don't have a lot of family doctors like me. In a well-functioning health system like in England, Germany, Sweden, Norway, Switzerland, the ratio of generalist doctors to specialists is 1-to-1. Here in San Diego, the ratio is 1 primary care doctor to 3 specialists. So the specialists outweigh us all. So if someone has pain in their, I've had someone that had pain in their chest, like, I don't know, a 30-year-old lady was very unlikely to have a heart attack, but if she goes into the emergency room in certain hospitals, she's likely to get a coronary angiogram. It helps pay the bills. I think that's disgusting. We need more family doctors, and there is part of that in the health reform legislation, but nowhere near enough.
Right here again?
The caregiver cost as an ADL conservator for my wife since 1971, I get around $1,000, and now that she's in the Mesa Vista, they said that $1,000 a month cost about that per day for her to be in the mental health facility. So it's counterproductive when you say to keep her in a mental health facility when I've been doing this since 1971 for under $1,000.
What the gentleman is pointing out is that he gets paid to take care of his invalided wife about $1,000 a month, and now she's in the hospital and it costs over $1,000 a day. But it's not just someone with a psychiatric problem. Take someone who's had a newborn baby or someone who's recovering from surgery. The fact is the matter is that we have a system based on paying doctors, not paying a team that would take care of people. Kaiser is a little bit like that, but nowhere near like what it is in France or England, where the team is there to take care of things that are not acute medical problems. And it does save a lot of money, and it is a rational way to go. But it doesn't happen much around here.
This gentleman and then Pat.
He's busy.
Okay, go ahead.
I just want to know if you have seen Sicko by Michael Moore and what you think of that movie, whether you can comment on it.
Well, would I comment on Sicko, the movie by Michael Moore? How many people here have seen it? Oh, well, we're talking to the choir. I idolized Michael Moore, but I'll tell you a couple of things. Sicko was embarrassing, wasn't it? Made me feel embarrassed to be an American. Because Sicko was not about, and Sicko in the whole dialogue is not about uninsured people. It's not about minorities who are getting screwed all the time, run out of town and not taken care of, die over there, but don't bother me. Sicko was about white middle-class people who had insurance, and they got screwed. That's why we need an Occupy Wall Street movement. But it goes further. You know, Sicko had a great play. It was in the movie for it was in the movie theaters for 6 or 8 weeks. All right? We all saw Sicko, okay? How many people saw Capitalism: A Love Story? Oh, almost as many. How long did that movie stay around? 2 weeks. Guess why? You know what the punchline of that movie was? We had a coup d'etat in the United States, and Goldman Sachs won. The movie died after 2 weeks. It was forced out of the theaters. Michael Moore is our hero. People ought to go around carrying him on their shoulders. Then they'd have to see the doctor. But he's made a lot of noise, but he never made as much noise as Occupy Wall Street. But you're singing the same tune. We've got this great burden in our country, and it's called Wall Street. And both for the health of the sick people, for the education of our children, for the comfort of our senior citizens, we've got to get rid of them. Thank you very much. I'm so glad you all did. One more question, Troy.
What are a couple of things you think we can do?
Well, I don't know who we is, but I really think that, you know, in my mind, these gatherings here and the gatherings in over 100 cities around the country are really like an infant. It's just something that's been born, okay? And the fact is that it's delicious because it's collective. Everybody has the same values. Everybody has the same message. But it's not going to grow into adolescence and maturity unless we have an agenda, unless we figure out a way to put political energy behind that agenda. And frankly, what I fear is that if this movement peters out without getting into action, then we're all going to be suffering more the year after next. So I think that you're all here today because you're interested in healthcare, obviously, but the fact is that fighting to get rid of the insurance companies is a target, just like fighting to get rid of your account in the Bank of America had a specific target. We have to fight to stop home foreclosures. We have to fight to continue to fund our school systems. We have to pick and support people who are doing that, and we have to get into political action to make sure the system does it. So that would be what I would answer that question.
Just one last question.
Sure.
In the single pay, it would be interesting, and your thoughts on it, towards trying to get us to have a union or something like that, to we could put together a holistic health insurance type practitioner, so we can get more people to pay into something that they would then have the funds for, like a banking process, that when somebody was ill, there would be funds together so they could have licensed practitioners of a whole circle of each type of practitioner studied within the state of California by law and the federal government, So there
Well,
could
I
be funds
understand. Well,
also
actually,
matched by the federal
you
government.
said something very important, which is, in fact, health insurance is very much like the banks. It's a place where you put money in to use for a rainy day. Except the insurance companies siphon off 30% of that for their own uses beforehand. And from the insurance company's point of view, alternative medicine like acupuncture or naturopathy or whatever is chump change. They personally don't give a shit. They're worried about neurosurgeons, they're worried about ambulances, they're worried about hospital days which cost $60,000 a day. They're worried about this man whose daughter spent 4 hours in the hospital and her bill was $7,000. Okay? That's what insurance companies worry about. Alternative medicine is chump change. They don't give a shit. That's it.
But it's still, there are the alternatives of, as you were stating, that instead of, a lot of people are getting over-medicated or wrong diagnoses or not the opportunity to try other alternatives for the method of something.
Well, I understand, but we're here to talk today about why the system doesn't function for all kinds of sickness. I agree it would be better if we had more alternative and preventive medicine, but the system is organized to take care of the people who are already falling over from sickness.
We are.
It is not a wellness system.
To this, we are like trying to pull us to be that 99%. So we have to get that 99% to believe we are the people in the federal and state should support a move that we put down that we believe is fair for us all.
I agree. Thank you all for coming.
Thank you.
I want everybody to know, since I was ill-prepared to introduce Dr. Jeoffry Gordon, I just want you to be sure to get his name. He's Dr. Jeoffry Gordon, and I'm not sure, but I believe he's local.
He's in Ocean Beach.
He's in Ocean Beach.
Ocean Beach. Okay.
And he's in the phone book.
Thank you.